All right. Welcome, everybody, to our June Scholars webinar of the Cancer Prevention and Control Research Network Scholars Program. Wonderful to see everybody, and we thank you all for joining us even in the summer months. My name is Daniela Friedman. I'm Principal Investigator of our CPCRN here at the University of South Carolina, and co-lead the Scholars Program with Dr. Escoffery at Emory University. And I also want to thank Courtney Patagna and Ali Husick from Emory and South Carolina for helping to plan today's event and all wonderful things scholar related. Today we have scholars with us, we have mentors, we have members of our Scholars Planning Committee, and we thank everybody for being here. Today's topic is one we have been waiting to present on for a while. We get lots of questions about the topic, and it is focused on systematic and scoping reviews. What are they and how do they help with our research? We have three wonderful scholars and CPCRN colleagues presenting today and serving on our panel. They're going to each present for about 12-ish minutes about their experiences and expertise with systematic and other types of reviews. And then we welcome all questions in the chat and afterwards, and we can have a nice discussion. I'm going to start by introducing all three of our speakers, and then we'll pull up the slides and get started. First, we have Dr. Jennifer Leeman, a professor and associate dean for research at the University of North Carolina at Chapel Hill. From 2012 to 2023, Dr. Leeman served as principal investigator of UNC's CPCRN, and she served as co-investigator on multiple NIH-funded studies to develop and then apply methods for conducting mixed methods systematic reviews. We also have Dr. Roger Robles-Morales from University of Arizona. He is currently a PhD student and clinical researcher at the University of Arizona in clinical and translational sciences. He received his medical degree at the University of Guadalajara, specializing in OBGYN and gynecologic oncology. He has been a CPCRN scholar and co-investigator on our cancer survivorship work group, and his research is focused on culturally tailored interventions for gynecologic cancer prevention and survivorship, binational research, and translational science. Finally, last but not least, we will hear from Dr. Escoffery, professor in the Department of Behavioral, Social, and Health Education Sciences at the Rollins School of Public Health. She is the PI of the Emory Cancer Prevention and Control Research Network, and her focus is on chronic disease prevention and control, translation of evidence-based practices, and implementation research. So we are now going to take you on a journey about systematic reviews. What are they? How do you do them? And to have some specific examples of reviews. Take notes, ask questions, and we will look forward to the discussion. And we are going to start now. And I'm going to turn it over to Dr. Leeman in just a moment. As soon as this turns into presenter mode.
There we go.
Excellent. Thank you, Jennifer.
So I am going to do a very brief intro to literature, systematic reviews of literature, really one slide intro, and then tell you a little bit about the lessons I've learned over many, many years of conducting systematic reviews of literature. So systematic review answers a defined research question by collecting and summarizing all empirical evidence that fits pre-specified eligibility criteria. I find it helpful to think of systematic reviews as being very similar to any other kind of research study. You have a sample, and in this case, instead of being patients or community members, your sample is the literature, drawn from the literature. So each study or each article is your sample. And you have to use systematic methods to identify your sample, and you also have to use systematic methods to collect data from your sample. So more specifically, a systematic review should include clearly stated objectives with predefined eligibility criteria for studies, explicit reproducible methodology, a systematic search that attempts to identify all relevant studies, assessment of validity of findings of included studies, and a systematic presentation and synthesis. Next. So these are the 5 lessons I'm going to go through in what I have learned over the years. Next. The first so systematic reviews are not for the faint of heart. They are a lot of work. And some of the ways, so my lessons in part focus on how to be as strategic as possible to make it as manageable as possible. And the first is to make sure you have a focused research purpose or question. And really, systematic reviews can address a broad range of questions. Typically, you are starting out with something you want to know about. And then you can put that in the form of how effective is an intervention at proving one or more specific outcomes. That's probably what we're most familiar with, but you can also do a systematic review to look at what measures have been used relative to a specific outcome and the data on their psychometrics, the association between 2 variables, more of a general understanding of what types of interventions are out there. The list can go on and on. Oh, you can just keep clicking. Okay, one more click, I think. All right. So the important thing to make this manageable is to take the time up front to get a focused question. And so I give you an example from a systematic review that was done as part of a CPCRN cross-center project, where we were really interested in capacity building. And so we really wanted to know what strategies are effective at building community partners' capacity to implement evidence-based interventions. So that's what we were interested in. So that's starting out broad. You want to take the time up front to tighten up your research purpose and question, and to refine it. And the first thing you should always do is search for other systematic reviews related to your topic. And that's because you want to make sure you're building on what others have already found and not replicating. And then you want to do a preliminary search of the literature around your topic. Next. And as you look at what's already been done, this is before you start your systematic review. You are doing this playing in the literature to figure out how much and what types of research have been done on your topic. Is there a substantial body of findings from rigorous research studies, which would indicate focusing your question in one way versus is the field in the beginning stages of defining terms and testing strategies, which would indicate potentially a different focus on your research question. Next. So this is what we ended up with our research question for this systematic review. And the literature in this area at that time was all over the place. There were not very many strong, robust studies at all. And so we decided, rather than focusing on effectiveness as the primary goal, we would focus on just developing an understanding of what strategies are being used to build practitioners' capacity, and then look at what evidence there is for effectiveness. The second lesson learned is, I'm not going to go through the different types of systematic reviews, but there are a number of different types of systematic reviews. And when you do your review, you will want to closely follow the guidance on the prismastatement.org website that journals, just about all journals now, are going to expect you to have followed. Very specific guidance for conducting your systematic review, and this website will provide you that guidance. Next. So the search itself needs to be done systematically. To identify an initial listing of potentially relevant articles, and then to narrow that list down to the ones you will include in your search. In doing this, I strongly recommend working with a librarian. They have the skills to help you do this correctly. You are expected to have 2 people review titles and abstracts to decide which ones to move to a full manuscript. So you want to find another person. You want to keep detailed records of the decisions made at every single step in the process, because you will need to report that in your article. How many were initially retrieved from each database? How many were selected to go to the full manuscript? How many were excluded at the full manuscript stage, and for what reasons? And I strongly recommend you look into using Covidence, which is a software that can help you, is just really lovely at helping you keep track of 2 reviewers' decisions in the selection of articles process. Next. All right. So this is another place where you can lose all kinds of time. And it's important to be really thoughtful about your extraction of data. And so extract only what you need from each article, and that will require some forethought. You need to describe your sample. You'll want to have a table in your article that describes all the, either in the article or as reference material that describes every single publication you included. And you will want to extract the data you need to create that table. You'll want to extract the data needed to assess risk of bias, and we'll talk just a little bit more about that. You'll want to extract findings related to your research question, and this is where you really need to do a lot of thought in thinking about what is it you need to know to answer your research question, and how are you going to organize that and extract it. And I think it's always helpful, to the extent possible, to use an existing framework to help you frame how you're going to conceptualize concepts and their interrelationships as you do your extraction. And just as an example, for the article I showed you earlier, we used the interactive systems framework as our organizing framework for the data we extracted. And this next one may be my, oh, I have a couple more slides related to this final point, which is my most complicated point, which is PRISMA does, here's something that PRISMA, which is the guidelines for systematic reviews, says you have to include study risk of bias assessment, and says specify the methods used to assess risk of bias in the included studies, including details of the tools used. And so there are a number of tools out there to assess risk of bias in the studies you're including. I most often use the MMAT, Mixed Methods Appraisal tool in the studies that I use. The tools are often designed for 2 people to use to score the study on various criteria and come up with a final score for risk of bias for quality of the study. I recommend against using the tools in that way. There's several reasons. It's difficult to do it well, it's time consuming, and it's not clear how helpful the final scores are when you report at the end. Oops, we went backwards. So if you can go forward, I'll show you what I recommend that you do. Still use the tools. So what I do is typically take the MMAT, and it includes criteria for assessing risk of bias across different kinds of studies. I then look at what criteria are most relevant to the body of literature that I'm reviewing. I then extract that data from every single study. I then create a final table where I'm describing the studies, and in my description of the studies, I include those criteria. So for example, I include sample size, study design, if there's relevant information about the measures, etc. Then in the findings section, when I report my findings, I use that information to give differential weight to findings. And the example here is saying 3 large RCTs demonstrated significant between group improvements in self-efficacy. In framing it this way, I have included the criteria that the reader can use to weight the findings and say, oh, these findings are based on 3 large RCTs. And then I still cite the tool as the source of the criteria. So I've met the PRISMA guidance without actually providing final scores for each bias for each of the studies. So that is my presentation, and I turn you over to the next.
Thank you so much, Dr. Leeman. I have 3 questions already, and I'm going to save them. But thank you for your presentation. And now we're going to go on for our second presenter. Dr. Robles-Morales is going to talk to us about the importance of the search strategy for review papers. And I'm going to turn it over to you, Roger. Thank you.
No, thank you for having me. It is a pleasure to be here now, giving the lecture instead of reading it like last couple of years when I was a scholar. I hope this is of use, and if there's any question after this, I'll be happy to help you. So whenever the immediate thought that comes to our minds when we think about a search strategy, at least in the clinical setting, is going to PubMed, right? But that actually only accesses primarily Medline database. However, when we're talking about a search strategy for a review, let alone systematic review or scoping review, it requires that we very methodologically and very analytically create a search strategy concerning all these points listed here. And for this, we need to go and do all these steps and write that down with the objective that anyone, if they want to do the same search as us, to be able to get the same results as we do. So every time you're going into a step in a systematic review or a scoping review, you should write down what you're doing, not only on the protocol of designing, but also why you're doing it, so you can describe it on your article. As Jennifer mentioned, ideally, you will find a professional health librarian. Even though myself and some of my colleagues, physician scientists, or even public health experts, they've done our systematic searches ourselves, the collaboration of a health librarian will definitely provide expertise in the use of multiple databases, because you can be very savvy in PubMed and have no idea how to use others. And also they know a lot about shortcuts, in particular databases, within the particular databases. And they also have access and expertise in the use of programs or softwares like Covidence, or like the one that I use, that is Stellar. And that will help you not only with the selection process, but also with the risk of bias analysis. So it goes without saying that for a good review, you need a good search strategy. A limited search is not enough. Not only will that add to selection bias, but it will also provide an incomplete review. And remember, when you're doing a systematic review, you almost kind of promising that you'll review all the evidence that is out there. So you need to be as thorough as possible. And also you need to have a very good balance between sensitivity and specificity. For me, it's easier because I work a lot with those terms. So think about sensitivity as the ability of a search strategy to correctly identify the articles related to our research question. And specificity, the ability of your search strategy to correctly identify articles that are not related to our question. So with that in mind, we should follow guidelines. If we follow the Cochrane principles of a systematic review, our search requires the use of wide variety of sources, not just one database, not just one limited source, but a variety of it. Again, you're promising to review all the literature out there regarding your research question. The ultimate goal of creating a great search strategy is that our review is widely applicable. If you don't have any limitations or practices in other countries or languages, then your findings will be applicable in any settings if that's what your research question is trying to get. And again, the higher, with the sensitivity, the more the better. You will get higher promotion of relevant reports. We do have to be very careful, because if that will ultimately make the reviewers work a little bit harder. If you get 20 hits, 20 articles to read, 20,000 articles to read instead of 200, then there may have a variation on the reviewer's work. But again, the more sensitivity, the better. We at least need to use a minimum of 3 databases. There are a lot of healthcare databases, some super specific to particular professions, and some others that include articles according to language. So and also others that are specific to great literature. So again, as you're promising to review all the literature around the world regarding your research question, if you have the ability, like we do in the University of Arizona, that we have multiple international students, I will recommend that language should not be a limitation. You should read all the articles in Spanish. You should read all the articles if you can in Chinese, if there's a person that you can include. Again, you can have the limitations you want to, but if you have the sources on your campus or in your setting, look for them because it will make a better review. But what do we need or what do we require to design an adequate search strategy? So first, for me, it helps because I have an OCD, but it requires a structure. We require a very well-defined research question. And for this, I suggest the PICA structure or its variations in PECO, PERT, or other else. So P is for patient population. What do you want to study? E, interventions, issue, or exposure. So what interventions do you want to analyze? C for comparison intervention, which is optional. What is the comparison of the intervention? And finally, the outcome of entrance. What is the outcome that you want to assess? After you have defined your review question, then you go and look to the best types of studies that are going to help me answer that question. So if it's a review of an intervention, then we certainly need randomized controlled trials, or at least controlled trials. If we're reviewing a diagnostic test tool, then we need cross-sectional studies or cohorts. And if we're doing a prognostic study or a prognostic review, then we need any type of descriptive studies. So again, keep in mind, what is the best type of studies that can answer my research question? So at the end, when we all have all this, what is it necessary that we include in our search strategy now at the database? After that, we at least need our population, intervention, and exposure. With this too, and of course, you can add the studies, the study design, you can get a pretty defined search strategy and correct hits. And for this, I'm going to help give an example of a systematic review that I'm working with here at the University of Arizona with 3 collaborators from CPCRN. The title is, and I also recommend that the PICA question should be included in your title. When you do systematic reviews, you do a title abstract selecting processes, as Jennifer mentioned. So again, if you want to help future reviewers, put your PICA question on your title. It will be easier to understand if your article is related to a question that it's available for reviewers. So here's the question. Style behavior change interventions among adult rural cancer survivors, a systematic review. What would the population be? Can anyone jump in?
Adult rural cancer survivors.
Exactly. Adult rural cancer survivors. And then what would the intervention be? You're correct. Lifestyle behavior change interventions. So as we are not limited any type of intervention just yet, this will be good for our search strategy. And which type of studies do we need to include? Any primary studies that are controlled trials. We don't need every randomized control trials, because when we do behavior change interventions, it is very difficult to blind the study and to randomize. In some cases, what you do is let the participant decide if they want to have this or that intervention. So do not exclude control trials just because they're not randomized, at least if you want to have a full answer. But there are exceptions. Of course, this is another systematic review that we're working here at the University of Arizona, and we are looking for factors associated with cancer treatment delay. And we now included population, interventions, or issue, and we are including the outcome, which is treatment delay. And we actually included a figure analyzing this for everyone to read. Now we can see the PECA strategy, how it relates to the inclusion criteria, and how it relates to the exclusion criteria. And of course, this can be translated to a search strategy. Population, adult people with these kinds of cancers, because we did not look for all the cancers available that are present. The exposure, as you see, any one factor related to treatment delay, and the outcome is treatment delay. And we included all this, the studies that can give us odds ratio, risk ratio, relative ratio, or beta coefficients for each individual exposure. So with this in mind, how do I do the search? So first you have to include all the synonyms that you can think of. For this case, for breast cancer, I'm giving you an example of breast conserving surgery. An excisional biopsy can be just it, a tumorectomy, a lumpectomy, a breast conserving therapy. So I'm just giving you examples of how a term that is called breast conserving therapy can have a lot of synonyms. You should work with experts on the database to include truncations and wildcards, like the asterisk between a word that would include anything that includes these 4 letters: breast surgery, breast implant, like that. And exploded, which exploded when you use a mesh word, it would not only include that word, but all the key terms that are included in that mesh word. And of course, use Boolean operators like or to widen your sensitivity, and to limit and to add to widen your sensitivity with breast neoplasms or breast cancer or ductal, which are synonyms, and tumorectomy. So all articles that include this, but they also have to include this other because we're using the and. And of course, use filters according to your protocol design. You're limiting your language, use your publication, etc. So after that, or before that, after you have this, before you do the search, I recommend that you do a table like this. You do a table with your concept 1, which is P, your concept 2, which is the exposure, and concept O, which is the outcome. And you look for control vocabulary or subject terms or mesh terms or entry terms if you're using Medline. Like this: breast neoplasms, uterine cervical cancer neoplasms. And then you look for the concept 2 mesh. You look for the concept 3 mesh, which are the treatment. And then you list all the possible synonyms that you can find. This could be medical terms. It could be layman's terms. It could be legal terms, whatever terms that you would think of when you think about this term. In the example of breast neoplasms, you can obviously think about breast cancer or cancer of the breast, or ductal invasive carcinoma, or lobular invasive carcinoma, which are types of breast cancers that you need to include on your search. Again, time to treatment initiation delay, delayed treatment seeking. And you can then use like a sort of an adjective, which is actually a shortcut when you use the use of text word, which it will be telling the database to look this term completely in every part of the text that is published. Any part, the title, the abstract. It could be also under the acknowledgments. Whatever part of the text that mentions this, it will be included on your article set. And how does this look? How are we in time, Daniela? Are we okay in time? So I'll just change to PubMed now. So this is how you look for mesh terms. You go to PubMed, and as a database immediately comes here, right? So now, when you open the mesh database, you're looking at my Chrome page, right? You are? Perfect. So now you have the mesh terms. And again, I'm going to use breast cancer. So you press breast cancer and you click search, and automatically it will give you the mesh term that mostly fits your search. And when you press on it, then it will give you the subheadings that you can look for, like blood supply, etc., and all the entry terms that are included under this mesh term, breast neoplasms. So when you put the XP before this, which is explode, it will look for all these terms and also the synonyms that you have added with an or, right? So after you do this, I would recommend that when you're looking for synonyms, you go back to just the PubMed. And you assess the advanced search option right here. With this, you can select where do you want to look for that word. I would recommend using text word, or if you're looking for mesh words, you can use mesh word, but for text word, you can put breast cancer. And then you can add show index, and it will give you all the terms, all the papers that are included in PubMed that include this breast cancer search. So you can add this as synonym because this will give you 3,000 or more hits this term. So you add it to the synonyms. And you can see that breast cancer 1, I don't know why, but breast cancer 1, breast cancer 23, and you can be adding like that. Or breast carcinoma. You can press show index and it will give you at least 20,000 articles that talk about breast cancer. So this is how you look for your synonyms and your mesh terms.
Roger, you're doing well for time. You've got a few more minutes. I appreciate that you showed us the PubMed. I thought that was great.
Perfect. So now after we move forward, I added this to make it quicker. I'm going to give you some examples of how does this looks in an article. You need, again, to write all this down. And this is a way that our librarian helped us do it in Ovid Mainline. We put the searches, and she used the breast neoplasm mesh terms that I showed you how to get. And she used the term Exclude. Then she used the uterine cervical neoplasm, the prostatic neoplasm, because we're included a lot of these cancers, right? And then she's adding the most common synonyms: breast or ductal invasive or lobular invasive or cervical or cervix cancer. Well, so you can see this, here are the synonyms. And then she added a truncation. Everything that includes this and neoplasm or cancer or carcinoma or adenocarcinoma. So all the words that are including this will come up. And then she uses a way to unite them. She's uniting 6 and 7 together, or to amplify or give more sensitivity, number 1 to 5. So we're actually searching for all of these terms together. And then we're going to add an N to time to treatment. Or you can simply set it like this, because this will come out as a PubMed result. You can just copy and paste it, and everyone that can copy and paste this and put it into PubMed will get the results that you're getting. And you can show them that you have done a correct search strategy. And if they want to reply or an update years from now of your review, they should use the same search strategy and just update the next articles available. I recommend that you try to do your search strategy, not only for systematic reviews. I used to do this when I gave lectures during my GYN oncology classes. And I remember my teachers and my mentors loving it that I stated, for this class, I did this search and I got this article. So I use this articles for this class. And it was like, oh my God, you look for the best articles available to your topic that you're assessing. With this, I finished. I hope this helps you. And if not, I can help you again anytime you need.
Fantastic. Thank you so much, Roger. And I like how you led us through an actual search. So that's fantastic. Now we're going to turn it over to Dr. Escoffery, who is going to share a specific study that she and her team worked on. And I'm going to turn it over to you, Com. Can't wait to hear about it.
Thank you so much. Thank you for inviting me to be part of this distinguished panel. And I want to build on everything that Dr. Leeman and Dr. Robles-Morales said. And it's actually very nice because I'm going to spend a little bit more time on the methods of abstracting and that process. So they spent a lot of time on the previous areas. So I'll go over the first one a little quickly, then describe a systematic review methods in general, and then apply it to our HPV vaccination intervention that Courtney and I have been working on here at Emory with others. Discuss our PICO's example. So thank you, Refugio, for introducing that, and also show how we applied it in ours, and kind of share some selected results in terms of how you can share what you're finding. So we did cover a systematic review, and I just wanted to really emphasize that you do want to think about your research methods and also what you want to know. So one of the things I do in the very beginning is just to Google, systematic review or scoping study, for example, depending on what you're doing, and for your health topic, because you want to see if there's related ones out there, when were they done, was there any one done, so you're being really novel, or are you expanding or building on others? So that's one thing that I think is important to do before you undertake a scoping review or systematic review. And I think the bullet points here, and as the other presenter said, it's a very systematic process. And so we'll go through that. I find it very helpful as a researcher myself. So some of this is more self-reflection, kind of like Jennifer's lessons learned, because systematic review kind of gets you an understanding of what is your area, whether it's an intervention or strategies to increase some type of behavior. So really combining what the current knowledge is on an area. It also helps you when you're finding your results, really try to understand the generalizability of what's in the research. For example, is it all based in, one group of populations, like white women, for example? And so can your review really add to the literature and increase generalizability? And of course, we talked about having systematic review. If you're looking at one study at a time, you're only knowing or understanding that study at a time, but systematic review and scoping studies kind of give you a better sense of what the results are. And if they employ stronger research designs, then you're not basing your findings or your judgment on one study alone. You're actually looking at the literature and looking at different types of study design, hopefully some stronger designs to really give you some implications, for example, on does that type of intervention really improve whatever outcome you're interested in. So for our review that I'm going to be talking about, it's creating an updated systematic review of interventions to promote HPV vaccination. It's not one of our scholar work group for CPCRN this time, but HPV vaccination has been a topic of interest in CPCRN past cycles, and it's actually the focus of the Emory CPCRN, which was, and this is one of our formative study that we did. We also did a qualitative study. So this was, again, to kind of get a lay of the land, as I said before. Jennifer talked about research questions, and so our review questions were the 4 identified here. We're really focusing on the audience and levels of interventions. And so when I talk about levels, I'm talking about interventions that are single or multi-level. We're wanting to know what are the components of the intervention. We were also interested in a little bit of facilitators and barriers to the delivery of these programs, as well as the study outcome, which is a common question. And so our outcomes really reflected our interest in 2 main variables, initiation and completion of the vaccine. So we talked a little bit about methodology, and as the other presenters said, you can find different methodologies out there, and it's very helpful to either adapt them or use them. So there is, I work with the Community Guided Preventive Services on several consultations of their systematic review. So they have a process. Cochrane Databases also has many others. And as both Jennifer and I will reiterate, a lot of times when you're publishing, particularly systematic review, you can also use the PRISMA guidelines, which I'll show at the very end. So these are the steps that we did, and I think it's pretty common. So we assembled our project team. At first it was Emory, but then we realized just looking at past reviews that there's, a potential great body of literature. So we actually invited other CPCRN researchers and students to be able to help us. So we had students, doctoral students and M.Ph.D students here at Emory, and we had 5 other CPCRN teams helping us, or centers helping us. So I think we had at least 10 pairs of teams. We defined our research questions, and not every systematic review does this, but you might also have a conceptual model, and I'll show you an example of one, particularly if you have interventions or if you're looking for different things to define. In your search strategies, which was just covered, you want to define what your inclusion and exclusion criteria are. Look at what your search strategy is with the assistance of a health services or a librarian. Be able to define all of your conceptual approaches or elements that you want to have. Then you want to actually do the data collection, so abstract, conduct a quality assessment, so choose a quality assessment tool, do full data abstraction, and then you're going to be able to analyze it in some ways, counts, percentages, graphs, and synthesize your finding, and then present summary tables. So this is a little bit of our method. So this was our multi-level kind of conceptual model. So the interventions that we're trying to find, we're grouping them into were they at the personal individual level, and on and on and on, all the way to the policy level. So that was one of the conceptual frames that we used. And then we looked at series initiation or completion of HPV. And again, it's 2 or 3 shots depending on age. And of course, that will lead to reduce HPV preventable diseases. I won't iterate this too much, but we did use 5 different databases that you see here. And we did meet with our Emory Health Sciences librarian for guidance. Some of our different words are here, and they do map out to our mesh heading, medical subject headings that they were able to help us with. I wanted to spend a little bit more time on the data abstraction process, because the other 2 kind of more talked about the beginning of a systematic review. So in the data abstraction, we tried to identify what were important study characteristics. Again, these were intervention elements that we wanted to capture. We created a code book. This really helps because if you have a lot of different studies or results from your search, you want to make sure that if you have different teams abstracting, that you can have training and have a way that people know what elements that you want to collect. We did test the code book and did pilot abstraction, and then we actually did the second part of the review process. We had 1 reviewer abstract, and then a second person basically checked the abstraction and add and commented. So then we reached consensus. You can also have 2 independent abstractor. We didn't do that. That takes a little bit more time. And as I mentioned before, we train everybody on the abstraction process. We were just introduced to the PICOS framework. So in our application, the issue were HPV vaccination. The population were all populations that were part of the intervention education or vaccination program. We did focus on interventions, and of course, in comparison, our control part of the PICOS, we abstracted any type of design or intervention design, so randomized quasi non-experimental. It just had to have one of our main outcomes. So that was the last row that you see there, HPV initiation, completion, or both. And so this is one way that people use in terms of one aspects of data codebook elements. These are other things that are commonly abstracted. I've done probably 20 systematic review. You often want to look at study characteristics. So I talked about the design intervention components or methods, delivery methods. You want characteristics of the population. Whatever your outcomes part, if you have outcomes, they define those study qualities and limitations. So that's your quality assessment. And then I often have an open-ended area where people can put comments. So, sometimes we exclude interventions that are there that might be protocols. I mean, they are interventions, but they haven't been done. So obviously they don't have outcomes. Sometimes we come across other systematic review or scoping reviews. And so those aren't single article interventions. So we exclude those. So that's some of the things I often include in quality comments. The next couple of slides, I'm going to go pretty quickly because they're really just examples. So this is an example of our data code book that we had. And so this is what we train people with. And we had a company Excel database where each of the rows, which is a separate study, was actually abstracted. And so this I found was very helpful in being able to train each of the abstractor on what are we looking for in that field. And so we told them exactly what to enter. And, for example, gender, male, female, both, now we would add more non-binary, but at that time, we started this 3 years ago. It helps in terms of having it be done consistently so that we can create our formulas to do our counts, right? So, if we didn't tell people that they would do female, male, or some other types of things, and it's harder to kind of get everything collated at the end. This is an example of a completed data abstraction form, and it actually goes for pages, but this just kind of shows you how detailed you can kind of get even for those elements that we had. For quality rating or assessment, Dr. Leeman referred to this. Most people include this as part of their study abstraction, and so there are a lot of different tools for this. Basically, what you're looking for is quality of the design, data collection methods, the rigor of the study, anything that reduces rigor, such as high attrition, meaning loss of your particular, in our case, intervention. And so these are some of the things that you can use. A lot of times you want to use a standardized scale or form across all of the different studies. So there are a lot of tools out there. You can actually find a couple of review articles on quality assessment kind of measures. We went with kind of at least the lowest common denominator because we knew that we were going to have some non-experimental pre and post study instead of just choosing randomized controlled trial quality assessment tools. And so we use this NIH quality assessment tool. And so, for example, it does ask you about study questions, what were the number 4 inclusion criteria, were they well defined? And so you can kind of rate them yes, no. Other elements on the next page were related to how much loss to attrition there was in number 9, what type of frequencies were the outcomes measured in number 11. So all of them will have different questions. I just wanted to show you an example here. And so this is our coding scaffolding. Just to show you, we had people abstract from the code book all of the elements in Excel. We had the second reviewer to go back to that same Excel row and made any changes in a different color or bolding so that we knew that there needs to be discussion or changes. And that led to the consensus or a consensus meeting if we need to have further discussion. And then all of that, got into a final data abstraction. So each study with its row was complete so that we would have that for the final included studies table. So just to kind of highlight some things, this is a typical inclusion flow diagram. So you can talk about, we had over 1,200 studies identified. We had duplicates removed and some of the reasons we kind of tried to explain that. And in the very end, we had 79 studies. So this is a lot for a systematic review, which is why we're still working on the proofs right now. Just highlighting some of the PICOS areas that we were interested in. We were interested in where the studies with the interventions for HPV focus on adolescents, young adults, parents, or caregivers. And, this was coding them to the primary one. And multiple studies, if they had different audience, obviously were counted. And then one of our questions was related to the single versus multi-level. Not surprisingly, we found that many of them were focused on one level, such as the parent or the adolescent, and very few were on multiple levels. So that was one of our findings as well. Just wanted to highlight what a quality assessment table can look like. A lot of times these are supplemental tables, perhaps if your journal is interested in this. So for each article, the questions here, we kind of define what were the intent of that particular questions. And 1 means yes, and 0 means no. So we kind of define that in terms of what it looks like. And then the study got a final poor, fair, excellent kind of rating. And so you could see a lot of the studies got a good rating. So most were in the good to fair rating in terms of our particular 79 studies that we looked at. So we're actually working on the final systematic review proofs right now, and hopefully we would be able to share it with you, but I just wanted to highlight some of the methods and happy to answer any questions that you might have about it. Thank you very much.
Thank you so much, and congratulations on the publication. That is a lot of work, a lot of work. Thank you to all of our presenters. Let me pin you or spotlight you so that everybody can see you. We had a couple of questions in the chat and just want to open it up now. Let's see. I know, Rowena, you had a question specifically about meta-analysis. Did you want to share a little bit more? It looks like the question is here in the chat about number of studies that would be used in a meta-analysis. Let's start with that really tough question. Who wants to take that one?
I'll take it.
Thank you, Jennifer.
To simply say that when I do meta-analysis, I make sure to partner with a biostatistician with expertise in meta-analysis. And I would recommend that. My understanding is it becomes important to know the number of participants or subjects in a meta-analysis. So you're shifting from a focus on talking about what's happening at the study level to what's happening at the participant level. And it doesn't necessarily have to be an RCT. We have done meta-analysis of observational studies. And so we're looking at the relationship between variables.
Can you mesh the two together? Or is it recommended to kind of keep, like, if you do the meta-analyses, like these are the meta-analyses of the RCTs and these are of the observational?
Yeah, I've seen a lot of times people do separate tables for different types of study design. So yes, you can do that. So sorry.
Yeah, I was just going to add that it all comes back to the purpose of the meta-analysis, which is to use pooled data and analyze it together. The meta-analysis is actually the analysis, not the collection of the data. So you should never combine RCTs with observational studies because the outcome of measure, it's different of how you gather the information. So you should only combine RCTs with RCTs. And what you're doing is, if you combine 20 individual RCTs, you will pull their data and then calculate the relative risk or the odds ratio of this event or that event. If you do observational data, of course, you're not randomizing, the selection is different. So you should always do different meta-analysis. And of course, you don't know, as Jennifer mentioned, there are meta-analysis for observational studies. There are meta-analysis for everything, not just randomized controlled trials. But it comes down to the outcome of measurement, what you're looking at.
Sounds good. Thank you all so much. One other add-on question to that. So if you find that, your literature is pretty limited, let's say you just have like a couple in each type. So let's say we have like 2 observational, 2 RCT. Would it be recommended to split them up into 2 different studies, or still keep it within like the same manuscript and just say, this is what we found in those types?
I think that you should always need to plan for randomized control trial, but you shouldn't always do it. If you don't have the information to do it early 9, then you can talk this to your biostatistician. So in your protocol design, you say, I'm going to do a meta-analysis and maybe a meta-regression or whatever you need for the analysis. But sometimes you will not get the information to do it. And it's okay to simply say, I don't have the information to complete this meta-analysis.
Yeah, well, Lena, I would also say that, one of the areas that I brought up was the whole idea of generalizability. And I think these days we would also talk about equity and things like that. So if you only go to RCTs, I'm talking about my world, which is more public health, then you're going to really get limited number of studies, right? So we are interested in policy interventions as well as other types of things. They are not going to have quasi-experimental design or even randomized control designs all the time. And so I think it, really is your topic of interest and, what you can have. But for your question, I would say certainly if you have different types of design, you can certainly group them into different tables and outline what you're finding in separate tables. So these are our randomized controlled trials interventions. These are our quasi-experimental design interventions if you wanted to do it that way, particularly for meta-analysis, because you're kind of looking at effect size or some outcome of interest, variation or range, right?
I think that will make for a nice discussion section of the paper of the compare and contrast there for the quality and the summary. So
yeah, thank you all so much. I learned so much today. Thank you.
Excellent. I love hearing about the process and what you each shared with respect to even things like using covidence, which I agree is the best thing since sliced bread if you work on review papers. And I want to go back to Jennifer, your presentation when you were talking about the team involved and making sure that two people review abstracts and, making sure that it's not just one person going through everything. And then I think about the numbers that came up in the search result tables that Com shared and that Roger shared doing his search. I don't think I've ever worked on a review paper where fewer than 10 people were involved. So what is your recommendation when you're pulling these reviews together? It is a huge undertaking. How do you sell this to a team and how does it kind of get divided up process wise? I don't want to get into all of the details, but I know, we know that it does take more than the two people down the road. What do you recommend, Jennifer?
It really depends. Okay. So if you have a funded study and you're paying people versus what CPCRN does, where we're all paid, but none of us are paid for the amount of time we put into CPCRN, and you're looking for volunteers. I think Com did a very good job of talking through how setting up a code book, doing training, maybe doing some inter-rater reliability work, and if you're going to have a large team. And then nobody has too large a lift, but you have done your due diligence to make sure people are abstracting in a similar fashion.
Good recommendation. And Stephanie, I see her. Thank you for including that about Ryan and the other platforms that can be used for reviews. That's excellent. Roger, did you want to add something? You use that one?
I wanted to show you what I've been using because again, as Jennifer mentioned, we're not paid for this. So we do have three independent elevators. Okay. And we do something like this. We do, everyone will have these two reviewers. We do A plus B, A plus C, and B plus C. And we use this pillar, which is amazing too. Okay. And again, never alone. I think that doing it alone will actually greater the odds of biasing because you will be tired, you will select articles that so you need at least two, but I'll recommend the more the better. Not in the selection process, but 3, it's okay, I guess.
Okay, that's helpful.
Yeah, I think all of the things were mentioned are just trying to increase the rigor of your systematic review or scoping study or things like that. So he was just showing an example of the abstract selection process. So we would typically say, at least for that, having 2 people reviewing them, but sometimes people have more just because, as you can see, there are thousands of articles that come back. And so you don't want to miss something potentially.
Okay. I know we are at 2 o'clock and even the 79 articles come, that's a lot for the full abstraction. So I want to thank our esteemed panelists for sharing with us today. It is at the hour, and so we do need to wrap up. We will be sharing a survey to get everyone's feedback on today's webinar. And if you have suggestions for additional webinars as we head into year 5, we will be getting all scholars' input on the plans for our year 5 scholars program that will involve all of our scholars from the past few years. Also, look out for information about some upcoming calls that we'll be having in July and August for our scholars to provide updates on their projects and about our end of year celebration and presentation of our graduation certificates to all of our scholars. We really appreciate you all and your commitment to the scholars program. And please join me in thanking Jennifer, who had to rush off, unfortunately, and Roger for the excellent information that you all provided today. Thank you so much, everybody. Have a great summer.
Thank you very much. Take care.
Thank you. Thank you.
Bye, everyone.